Hey, welcome to the Waco Family Medicine Point of Care Ultrasound curriculum. This is Dr. Ryan Trantham, and I'm the POCUS coordinator for Waco Family Medicine Residency program here in Texas. I'm excited to go on this journey with you all, and I know that you may be coming in with various levels of point of care ultrasound experience in your medical school careers, and perhaps even some training on your own time. But my hope is that by the end of our time together over the next 3 years for a longitudinal curriculum, and for anyone who may be watching these remotely or asynchronously, that we teach you everything you need to know about point of care ultrasound to be a full spectrum family medicine doctor. Our first lesson focuses on what is point of care ultrasound. Before we get started, I wanted to introduce myself. My name is Ryan Trantham, like I mentioned, and I'm from Allen, Texas, which is a suburb in the Dallas-Fort Worth area. I went to high school up there and then went down to College Station, Texas to do my undergrad at Texas A&M University, where I majored in biomedical sciences. Originally, I wanted to go to vet school, but I changed my mind during college and decided that human medicine was for me and can't be happier with that change. After undergrad, I went to medical school at Baylor College of Medicine down in Houston, and then came to Waco to start my residency training, where I'm happy to stay on as faculty now. I'm a proud dog dad. You can see my little baby. His name is Doppler. He's over in the left corner of the screen there. Now about to be 1 year old at time of recording this, so growing up fast. And then outside of work, I like to spend time outdoors, stay active, travel, explore new foods and cuisines and cultures, and then sometimes be an introvert and play video games or practice my mandolin at home by myself. And in addition to myself, there's several other physicians that you may interact with during your ultrasound journey here at Waco Family Medicine. A couple people that would be important to know are Dr. Nick Schwadock on the far left. He was the pioneer of point of care ultrasound here at Waco Family Medicine several years ago. He helped purchase the first machines that we still use to this day and keep up to date. And he, after retiring from faculty full time, went over to Africa where he served doing some global health work. He's now back in a part time capacity, and you'll see him in the box and roaming around, and he can answer a lot of your ultrasound question needs. And then, secondly, we've got Dr. Brock Neisler. Dr. Neisler runs our sports medicine fellowship and will do a lot of the procedural and MSK ultrasound training that you'll get during your time as a resident. And then you got me. So, why do I like ultrasound so much? Well, it's because for the risk to benefit ratio, ultrasound is one of the most safe and most helpful exams that we can do at the bedside. Plus, there's just nothing better than having a patient smile, looking at the screen with you, interacting with you as you look inside their body and teach them about the disease process that you're looking for or looking at. It's also a readily available technology that doesn't cause a lot of issues. It's a relatively safe exam with low risk profile. I mean, we can bring it to the patient and increase their opportunities to participate in their own care. Point of care ultrasound in particular is an exciting opportunity because there's a lot of emerging evidence coming out, more studies as the technology gets more and more accessible, as it gets cheaper, and the chips running the newer probes are getting more and more sophisticated and able to give us more information. I think that full spectrum family medicine physicians, like the ones we train here at our program, are uniquely situated to lead in this field because, in addition to the standard fields of ultrasound that have already sort of cropped up in emergency medicine and in critical care medicine, we also experience outpatient opportunities and OB opportunities, and these are all skills that build on each other. Plus, me personally, I just think it's pretty fun to talk about the science and technology, and I'm a bit of a nerd, so ultrasound really piques my interest, and I hope it does yours as well. Let's talk about the history of ultrasound. So, ultrasound was invented in the 1940s as a tool to aid in diagnostics in medical care. Originally, these machines were very bulky, in fact, even requiring patients to be submerged in pools of water to get grainy images that, by today's standards, would be non diagnostic. But as technology progressed throughout the 1950s, 60s, and 70s, these machines became smaller, having higher resolution, and eventually became self contained, where you didn't need a water tank or a large transducer to be able to accurately image things. And then really the heyday started in the 1990s when machines finally were able to be taken to bedside and used in routine care for obstetrics and then eventually into the hospital. Now, people can hold an ultrasound machine in their hand, connect it to their phone, and as you can see from the last image on the right, there's a variety of options for portable ultrasound machines, which is why this is an emergent field that's really taking off. So I'm not going to bore you with a ton of information. This slide has lots of words on it, but the truth that I want you to see here is just that there's a lot of studies that have been done to tell us how POCUS can benefit our patients. It shows that physicians who use this are more cost effective, that they're just as accurate as some specialists for some basic exams, and that oftentimes POCUS as an augmentation to our physical exam can help us reach diagnoses faster and bridge gaps in care for patients. In addition to the intrinsic value of point of care ultrasound, there are a couple of guiding organizations for residents who have come out with guidelines or with suggestions about what you should learn during your time during residency. So the ACGME states that family medicine residents must have experience in diagnostic imaging interpretation, and that residents should have experience in using point of care ultrasound in clinical care. Additionally, the American Academy of Family Physicians put out recommended curricular guidelines, which is what I use to build the curriculum that we'll be working on throughout our time together. Point of care ultrasound is different from formal ultrasound in the sense that this is a limited study performed by the provider rather than being ordered and done by radiology technicians and radiologists. It's done at the bedside, and the information gained from the exam is used in real time to decide treatment decisions. So it can look for a pneumonia and identify it or rule it out. There are some established protocols, which we'll talk about, which can help us guide clinical decision making. And every now and then, you do need to follow up these exams with formal studies. Sometimes, just like in x-rays and other fields, you find incidental findings or your exam may be inconclusive, and we need the power and the expertise of better machines and formal training to make these decisions. But as an educational activity and as training, point of care ultrasound is a super useful tool that I hope that you'll want to master during your time in residency. So we've reached our first pitfall, which is a reminder. You'll notice that there's a little caution sign there to the left of the screen, and you'll see that throughout slides as we move forward in the curriculum. These are things that I feel like can trip you up or that may represent key points to take away from the curriculum. And this says that POCUS is a tool to answer a focused clinical question, not a full imaging study. And when we take that into consideration, it makes sense why we only use POCUS for particular applications and other things require a formal exam. But we'll get into that more as we move through the healthcare system. As I've mentioned, POCUS in the healthcare system is an emergent technology, and it's currently minimally regulated. And while that's a fun, safe sandbox and space for us to play in, it does mean that we need to be cautious about how we use, interpret, and communicate our results. Institutions have specific privileging requirements. That means that each hospital can decide who's allowed to use point of care ultrasound, and there's no universal credentialing or training process. Now, these things may be popping up in the future, and so I've tried to build this curriculum to give you the information that you need to go to future employers and say, hey, look, I was adequately trained in point of care ultrasound during my time in residency. This is a skill set that I have mastered and that I should be able to use while I am working in your hospital or your clinic system. Now, all of the scans that we'll be doing here do occur in the context of medical education. And so there's also boundaries that we need to think about in terms of ethics and supervision as you're a learner and a trainee. And those considerations definitely come into play when we talk about POCUS and the way we use it in the clinic. And then on top of all of this, this is all occurring in a environment where we're becoming more and more aware, thankfully, of social determinants of health and how the ethical, legal, and equity benchmarks of our care are affected by the social factors occurring outside of the clinic and outside of the exam room. And so while we implement and develop this technology, it's important that we think about how those factors affect our patients and our practice. So I've mentioned that POCUS is a guided exam to answer a focused clinical question, not a full imaging study. So what types of questions can POCUS answer? Well, as you'll see here, there's a ton of different questions that you can ask when you're holding an ultrasound probe. Is there evidence that this patient has pulmonary edema? Is there free fluid in the abdomen? How old is this pregnancy? What's the dating for this pregnancy? Is there a retinal detachment? So from a variety of organ systems, whether it's soft tissue or lung or cardiac, there's a ton of opportunities for POCUS to help us guide our decisions during a clinical examination. What you'll notice if you look at these questions is that generally they follow a binary or a dichotomous relationship, meaning is there something present or something not present? Is there evidence or is there not evidence? They also usually address a specific clinical scenario or an illness script. And so you'll have to know when an exam is indicated. You don't just throw an ultrasound on anybody, although sometimes I feel like I do, but it's validated for you to go in with a specific question that you're trying to answer through use of point of care ultrasound. And you'll also notice the wide variety of organ systems that these questions address. And that list of potential organ systems is only going to continue to grow as more and more people utilize this technology and find ways of incorporating its innovation into their practice. These are the goals which come from the AAFP Point of Care Ultrasound recommended curriculum guidelines. And they're mapped to the core competencies that the ACGME has laid out for all medical residents to grow and experience. I list these here mainly so that you know that these are the formal goals of the curriculum, but we'll talk about what our particular curriculum looks like at Waco Family Medicine in a little bit more focused realm. The Waco Family Medicine POCUS curriculum is a 3-year longitudinal curriculum. This means that you'll be participating in aspects of the curriculum throughout your 3 years in residency. You'll be learning through a variety of different modalities. Most of the information being taught to you is going to be posted on a Google Classroom module. And then we'll also have some workshops during our dedicated didactic time for us to practice with hands-on experiences or go into depth on some of the more complicated exams that you'll be learning. Independent of these exams, you'll have time to practice with your own machines. We have ready access to multiple machines here in clinic and at the hospitals. And I would encourage you to pull in your faculty or to use teleguidance to be able to practice some of these exams and get more information, or have one of us review it to see if we agree with your findings. And then lastly, there's the POCUS Clinic, which is an up-and-coming clinic process, which will allow you to spend some time with me and with some of our other ultrasound faculty in the clinic, scanning patients in a small group, hands-on the probe time, for us to go over things and also talk about quality assessment and how we make sure that the images that we're getting are adequately stored, handled, and interpreted, labeled, all of the things that need to be in place for proper point of care ultrasound use. On top of all of this curriculum, and you may be sick of POCUS by now, but there also are opportunities to do electives if this is something that you want to go into a deeper depth in and want to have some more time exploring this topic. And then I would welcome anyone who wants to do scholarly activity to write up a case series or to do a poster. I would be happy to coordinate that with you and help you use this as an opportunity to get published. I posted a list of goals earlier that were the formal goals of the curriculum, but I think if we had to distill that down into one rememberable phrase, what I would say is that all Waco Family Medicine graduates will complete the curriculum, meaning that they'll go through all the different modules and answer all the questions and get passing grades, and then also log at least 150, ideally 300 supervised scans in their POCUS passport and be issued a certificate upon graduation. And that's what I was mentioning you can take to your future employer to say, hey, look, this shows that I was adequately trained and I love POCUS. So using the curricular guidelines from the AAFP, I developed an 8-module POCUS curriculum that will be rolled out over the next 3 years. Right now, we're starting Module 1, the basics of POCUS. And by the end of your intern year, I hope that all of you will complete the OBGYN and cardiac modules. Now, some of these other modules, including the lung, abdominal, MSK, these things will be available on a rollout basis as I develop them, and some may be available even during your intern year. And if you're really motivated and you want to start working on those, then you're by all means free to do so. But the curriculum is guided to kind of teach the basics and some of the high yield exams like cardiac, OB, and lung early in the clinical process of your residency program. And then as you get later and later as a second and third year, moving to more of the outpatient and focused exams and specific protocols. But that being said, you'll be using all of these skills all the time throughout your residency training. Just to give you an example of what the ultrasound curriculum looks like, this is the educational strategies and assessment methods, but I want you to focus over here on the objectives. You'll have access to this curriculum. It's posted in Dropbox, and anytime that you're wondering sort of what are the goals, like what do I need to know from this curriculum, all of these objectives will be listed for you, and I'll try to include them in the slides during the presentations and at our workshops so that you can understand what level of detail I expect you to know before you graduate. This is an example of what the Google Classroom looks like, which you'll have access to here shortly. This is the home page, and you can see a link to track your progress as you work through the modules. I'll check you off and make sure that we're all on the same page, keeping each other accountable. And then here's an example of what the lessons look like. So here's the first module as I was developing it, and you'll see the completed version on your Google Classroom once the invitation gets sent to you. At Waco Family Medicine, we have a ton of resources available for you to tap into and utilize to best get trained. That includes our faculty, like myself, Dr. Schwadock, Dr. Neisler, and several of our other physicians. We also have a ton of machines that are available, and these are machines dedicated to resident education outside of the machines that we use in our formal radiology scans. So we have 5 GE Logic machines, and these have linear, curvilinear, and transcavitary probes. We're working on getting a phased array cardiac probe as well. And then we also have Butterfly IQ probes, which are the mobile portable ultrasounds, which you can plug into your phone or your tablet. We have both Apple and Android connections available. There's one of these in each team area as well as at the hospital, and there's one dedicated for centering pregnancy. In addition to these clinic-owned, we also have hospital-owned machines that are found in the ICUs and the ERs of both hospitals and are available to be utilized for patients that we have admitted. Each of you will be given an individual login to the Butterfly IQ network, which includes the place to upload your scans for us to review and talk together. There's also some education opportunities if you would prefer to watch those videos and not listen to my voice. I'm not going to tell anybody. And then there's the option to do teleguidance, which is the ability for you to call me directly or call any other user on the Butterfly network, and I can see what you're scanning, give you guidance in real time, and help you optimize your image. In addition to these formal resources, I'll also list a group of websites or trainings that I have found helpful, maybe a list of conferences that you could attend if this is something you're interested in, and those will be stored on the Dropbox and Google Classroom for you to use. So like I mentioned, this is a 3-year curriculum that's in development and being rolled out. And so we're starting the 2023 to 2024 PGY1 module implementation period. And you'll notice that I'll be assessing your knowledge, your skills, and your attitudes throughout the variety of modules as they get published. And so with that, let's get started. You should have in your emails already opportunity to log into the Butterfly network, the Google Classroom invitation, and we'll be going through new innovations to show you how to log procedures during your time here in orientation. I am excited to go on this journey with you, and I'll see you next lesson for ultrasound physics.